boosting your testosterone levels naturally is a must when it comes to energy levels, learning, memory, and testosterone helps support everything from mental clarity to muscle strength and even to weight loss. But are there natural ways to boost testosterone? Well, the truth is there are simple and low cost and even free ways to naturally boost your testosterone that is backed by science. And in this video, I'll show you evidence-based ways to raise your testosterone and see results in just a few weeks. And I'm also gonna go over a few supplements that are crucial in optimizing your testosterone levels. And I'm going to go over a supplement that I used to recommend, but I do not anymore as the evidence no longer supports it. I'm Dr. Leonid Kim, board certified in obesity and internal medicine. And on this channel, I discuss the most up-to-date and evidence-based information on the topics of metabolic health, longevity, weight loss. Let's get into it. So the first thing you need to do to boost your testosterone levels is not something you add to your regimen, but it's actually something you need to remove from your life. And that is your exposure to microplastics. And specifically, I'm talking about your common endocrine disruptors like BPA and phthalates. There's growing evidence that shows worrisome trends between microplastic exposure and many health issues. And in this instance, we need to talk about how microplastics affect your testosterone. So we have a study based on NHANES data from 2011 that showed that higher urinary BPA levels, meaning higher levels of BPA in your body, were associated with a significantly lower levels of testosterone in adolescent males. And it's not just BPA that we need to worry about. Many products that we use every day also contain phthalates, which is a chemical that is used to make plastic more flexible and durable. And there's another study that showed that high levels of phthalate metabolites in the urine, meaning high levels of exposure to phthalates, was associated with decreased serum testosterone in men. And that is because phthalates can act as anti-androgens, so they reduce the levels of testosterone and sperm quality. But the problem is these plastic products are everywhere, but there are certain things you can do to reduce your exposure. For instance, always choose glass containers or stainless steel containers as opposed to the plastic ones. And I would also avoid bottled water and your common water or coffee travel mugs. Many of them may say they're BPA free, but a lot of them still use BPA alternatives like BPS, which is probably just as harmful. And another common source of microplastics is actually through food packaging, as these prepackaged foods are often wrapped in plastic and the plastic wrapping can leach into the food. And then there's another common source of BPA, and that is from canned beverages and soups. So many aluminum cans are coated with plastic material on the inside, which makes it a huge source of plastic exposure. And we have a randomized crossover trial published in Hypertension that showed that urinary BPA concentration increased by 1,600% just after consuming 2 canned beverages compared to those consuming from glass bottles. And another source is I would also be careful with disposable coffee cups, even paper cups, as the inside lining of those cups is often made of plastic material. And this becomes especially problematic since this plastic lining in disposable cups can leach into your drink after it comes in contact with hot beverages like coffee or tea. Now, the next thing that has a huge positive impact on your testosterone level is good sleep. And what I want to emphasize is it's not enough just to get plenty of sleep, but what's more important is to get high quality sleep. Now, first of all, how much sleep do we actually need? Well, we have a study that shows that sleeping 5 hours a night for just 1 week can reduce testosterone levels by 10 to 15%. And survey data from NHANES that looked at over 9,000 men ages between 16 to 80 showed that impaired sleep was associated with lower levels of testosterone. Now, different people need different amounts of sleep, but most should aim to get at least 7 to 8 hours of sleep per night. But once again, what's even more important than the time of sleep is the actual quality of your sleep. And there are several things that can help. First, it helps to maintain a regular sleep schedule, so you go to bed and wake up at the same time, even on weekends. And the consistency will help your body naturally regulate its internal circadian rhythm. And another common mistake people make is the timing of caffeine consumption. So we have to be careful drinking coffee in the afternoon, as that caffeine you consume may not prevent you from falling asleep, but it will disrupt the quality of your sleep. We also have to be careful with the timing of alcohol consumption, as it's a huge sleep disruptor. Now, many people use alcohol to fall asleep, but what you get is the opposite result. Alcohol disrupts your sleep by interfering with the phase of your sleep called REM sleep. So alcohol will make your sleep less restful and will cause you to be more awake during the second half of the night. Alcohol is also a diuretic, meaning it will make you produce more urine, which is another thing that can keep you up at night. And there are so many other things to cover when it comes to optimizing your sleep, like light and blue light exposure, getting enough sunlight in the morning, regulating your temperature, having good pre-sleep routine. But that's a huge topic in of itself for another day. So another thing you need to minimize to fix your testosterone levels is alcohol. And we talked about how alcohol can indirectly lower testosterone by disrupting your sleep. But alcohol can also directly reduce both sperm production and testosterone concentration. And we have studies dating back as far as 1980 that show that alcohol is a toxin to Leydig cells. And Leydig cells are the cells in the testes that are responsible for producing testosterone. So in those studies, they noted that almost all men suffering from alcoholism had low normal or low testosterone. And when they looked at healthy male volunteers and exposed them to alcohol, testosterone levels began to reduce from baseline after just 72 hours of alcohol ingestion. Okay, the next thing is probably one of the most effective ways to raise your testosterone levels, and that is exercise. But not just any exercise. There are two very specific forms of exercise. The first one, no surprise, is weightlifting or resistance training. And we have some data that shows that testosterone levels go up immediately following resistance training, and the effects are seen for hours afterwards. And another type of exercise that is very effective in raising testosterone levels is high-intensity interval training. And we have studies that show that protocols high in volume, moderate to high intensity, using short rest intervals, and stressing large muscle groups, those high-intensity exercises tend to produce the greatest acute hormone elevation of testosterone and growth hormone. But really, we also have data that shows that any form of exercise can be beneficial in raising your testosterone levels. And there's a cohort study published in Europe that involved almost 700 men that shows significantly higher testosterone levels in men who claim to be physically active for 3 or more hours per week, compared to those who didn't. Now, when it comes to proper nutrition, there's actually not one particular diet that's been shown to definitively and consistently raise your testosterone. Now, I do think getting enough protein in your day is crucial to maintain your muscle mass, and it's important in weight loss, which further helps increase your testosterone levels. But beyond that, a balanced diet based on whole foods that is minimally processed is probably what will give you the best results. We do have some older studies that showed that a diet high in fat was associated with higher testosterone levels. But a recent meta-analysis showed that high-fat diets and low-fat diets actually resulted in a small to moderate decrease in testosterone. So once again, a balanced diet that prioritizes protein and healthy fats from whole foods without deviating too much one way or another is probably the way to go. The next thing that is important in testosterone balance is weight loss. And in fact, obesity is the strongest risk factor associated with low testosterone levels in middle-aged and older men. And to dig a little deeper, it's not just obesity, but more specifically, it's the increased waist circumference or increased visceral fat that poses the greatest risk. The visceral fat in our abdomen causes an increase in an enzyme called aromatase. And this enzyme converts testosterone to estrogen. But the good news is you don't need to lose a lot of weight before you can start seeing results, because even a 5% loss of your initial body weight can increase your testosterone levels by 58 nanograms per deciliter. And weight loss of 15% was associated with an increase of 164 nanograms per deciliter. Next, let's talk about supplements that you need to consider to optimize your testosterone levels. First, we have some evidence that a zinc deficiency is known to reduce testosterone, and the zinc supplementation in zinc-deficient elderly men for 6 months resulted in an increase in serum testosterone. Another important supplement to consider is magnesium, and we have a study from 2011 that showed that just 4 weeks of magnesium supplementation increased free and total testosterone in both athletes and sedentary adults. And lastly, the supplement that most people should consider and discuss with their doctor is ashwagandha. Now, ashwagandha has growing evidence when it comes to improving sleep and stress and even athletic performance. And if you take all those things indirectly will help you optimize your testosterone levels. And I want to highlight this small but a double-blind randomized controlled trial that showed that just 8 weeks of treatment with ashwagandha at 300 milligrams twice a day significantly increased testosterone levels and significantly increased muscle mass and strength. Now, I made a separate video on everything you need to know about ashwagandha, and I'll post a link to the video in the description below. Now, the supplement that is often recommended for testosterone that I actually no longer recommend is vitamin D. We had some earlier studies, like this one, that showed an association between vitamin D supplementation and increased testosterone in middle-aged men, but follow-up systematic review of all these studies available did not show any evidence to support the use of vitamin D in increasing testosterone levels. Now, proper vitamin D levels are important for many other health aspects, but there's clearly just no good evidence to say it can help with your testosterone. Okay, if there are any other supplements I missed or I haven't reviewed, let me know in the comments below and I'll go over those in my future videos. I hope this review is helpful and I'll see you in the next one.